This is Tom Fox. Welcome to the newest edition in the Compliance Podcast Network, my latest podcast, Compliance and Coronavirus. As the voice of compliance, I wanted to start a podcast which will help bring both clarity and sanity to the field of compliance, the compliance practitioner, and indeed the compliance profession during this worldwide health and healthcare crisis. Taking up a variety of topics as diverse as working from home to sporting events, to the role of the board of directors, to crisis management, to the role of supply chains. We will look at all of these in this podcast. If you have a topic you'd like covered on compliance and coronavirus, please let me know. I'd be happy to do a podcast on it. In today's episode, I have Jim Anliot, director at Affiliated Monitors, and we consider telehealth monitoring in the age of coronavirus. It's a fascinating exploration of where medicine may be going and how it may be monitored by regulators and insurance companies. Hello, everyone. This is Tom Fox back for another episode, and today I have with me James Anliot. James is the Director of Healthcare Compliance Services at Affiliated Monitors. James, first of all, welcome and thank you so much for taking the time to visit with me today.
Thanks very much for the opportunity to talk to you today.
James, I was wondering if you could share with our audience a little bit about your professional background.
Okay. I've been Director of Healthcare Compliance Services at Affiliated Monitors since the company's inception in 2004. Prior to that, I worked as legal counsel to a number of state professional licensing boards in Massachusetts for about 16 years. So I have a lot of background at this point in healthcare regulation, particularly at the state level. My responsibilities at Affiliated Monitors are to run some of our independent monitoring programs for individual practitioners and also to help healthcare organizations develop internal compliance programs for larger provider groups.
James, of all the changes that have been wrought by COVID-19 and the coronavirus health crisis, the explosion in telehealth services may be right up there at the top. I have experienced that personally. It was a very positive experience for me, but there are many facets to this story. And really what I wanted to visit with you about is how can you help, or how can a healthcare provider evaluate the performance of a doctor utilizing telehealth services? So could you maybe start by explaining what telehealth services principally are?
Well, telehealth services get delivered in basically three different ways. It's a way of, principally it's a way of having the provider and the patient communicate with one another without the necessity for an in-person visit to the provider's office. Those services get delivered in basically one of three fashions. One is in terms of real-time audio and or video communication between the provider and the patient, in which the provider and the patient are talking to one another essentially face-to-face via audio-only technology, a telephone, or via a combination of audio and video technology like GoToMeeting or a Zoom meeting or something like that. A second way to do this is what they call a store and forward encounter, in which the patient accumulates information, stores it, sends it to the provider, but the provider reviews it at a later point, so that the provider and the patient don't have any direct, immediate real-time communication with one another. The third is through what's commonly called patient data monitoring. This involves basically automatic transmission of information about the patient from some sort of monitoring device. It might be a blood pressure monitor or a blood sugar monitor or a heart rate monitor directly to the provider, who analyzes that data and draws conclusions based on the information they have.
James, it occurs to me that the evaluation of a healthcare provider is of great import to a variety of stakeholders. Obviously, a hospital or some other network which has doctors or other healthcare providers, an insurance company, obviously a state regulator, and perhaps even a federal regulator is very concerned with these issues. How has telehealth services changed this equation for evaluation?
Well, before telehealth services became prominent, both state and federal regulators and insurance carriers as well primarily evaluated the quality of patient care and decisions about payment for the evaluation and management of patients on reviews of a provider's patient treatment records. The content of that has become very different now. Basically because in a telehealth situation, you don't typically have an opportunity for the provider to perform any sort of a patient examination of the person that they're providing services to. There's no way to gather vital signs or to obtain physical exam findings. And in a lot of situations, you're not able to gain a lot of information about the patient's past medical history either, except through their own subjective reporting of things. So when we, before the pandemic hit, the most widely accepted standards for documentation of patient care services in medicine were basically the Medicare and Medicaid documentation guidelines for evaluation and management services, which were first issued in 1995 and updated most recently in 2009. Under those guidelines, the principal data points on which patient records were evaluated consisted of the nature and history of the patient's present illness or current problem, the extent to which the provider captured and recorded relevant information about the patient's past medical, social, and family history, the nature and extent of the provider's diagnostic examination and evaluation of the patient, including the scope of the physical examination performed and the amount of diagnostic testing and or imaging procedures that were done, and the relative complexity of the medical decision-making which is involved in selecting the appropriate form of treatment for the patient. The federal government relied heavily on those key data points in determining whether a record qualified for payment for services. Most state regulators relied on those same guidelines to evaluate a physician's performance, although some states did supplement those guidelines with specific content requirements of their own about patient records. The problem is that the state level, alleged failure to meet those documentation standards was one of the most frequently used grounds for imposing professional discipline on a physician. And those sanctions, in turn, often triggered exclusion from public and private health insurance payment programs. In the telehealth environment, however, the process of performing a physical examination of the patient and or obtaining diagnostic or testing or imaging is considerably more difficult, if not impossible. In a real-time audio and video interaction between the provider and the patient, the provider can't do a physical examination of the patient. They can't take vital signs. They can't perform basic physical examination procedures. And their ability to get diagnostic testing results has also become more difficult because the pandemic has forced providers of laboratory testing and diagnostic imaging services to prioritize patients who have COVID-19 symptoms. And some have even closed down or refused to accept referrals for such testing from providers who are seeing patients who don't have COVID-19 symptoms. So that's changed the way in which healthcare regulators and in the way in which insurance payment sources have had to try and evaluate whether a physician is delivering the kind of quality of care they expect and the quality of the services necessary to qualify them for payment.
James, in many other types of compliance, it is the regulators who sort of lead the discussion by changing the way they require something, by looking at something new, by adding a new requirement. Would that be a fair assessment in your world as well, that the state and or federal regulators are really leading this discussion by their actions, or is it something else going on?
They've clearly had to. State and federal regulators have clearly had to shift their focus a little bit. I think the whole issue of telemedicine has been under discussion by state and federal regulators for some time, probably I would say close to a decade. But for a long time, they had time to sort of try and sort out how it was they were going to evaluate provider performance in a telemedicine environment. Now, with the onset of the COVID-19 pandemic, that time frame has become very much compressed. And state and federal regulators are now having to jump to new ways of evaluating provider quality of care. And that's proven particularly challenging. Some of the ways in which the regulators have responded have been very interesting. Medicare and Medicaid, for example, at the federal level, have at least temporarily said that a physician who is providing services to a patient by telemedicine does not have to document the patient's past medical history and does not have to document any patient examination findings in order to be able to bill for the fundamental evaluation and management services, which are at the core of each physician's payment system. This makes sense logistically, but it makes meaningful evaluation of the quality of care difficult given what the guidelines we have been using up to now. What's interesting is that even though the physical examination guidelines in particular have been essentially waived under Medicare and Medicaid, the level of payment provided for evaluation and management services provided via telehealth is the same as the level of payment provided for those services when the physician is seeing the patient in person. And what now has happened is that Medicare and Medicaid have essentially made the time that the physician spends on that evaluation of the patient as the critical factor in determining what the level of payment will be. Before the pandemic, that was decidedly not the case. The federal authorities clearly took the position that the length of time you spent with the patient was not the decisive factor in terms of how much you got paid. State regulators have had to respond differently too. Their response has focused principally on four things. One is whether an in-person evaluation of the patient is required before telehealth services can be delivered. And the vast majority of the states who have addressed this question have basically said no. Telehealth services can be used right from the very beginning. States have also focused on the question of how telehealth services are to be provided. Most states have said that you can use either a technology which combines both audio and video at the same time, or you can use an audio-only technology like a telephone call to deliver health services. Their only insistence has been that whatever technology you use has to meet federal HIPAA information security standards. The question has arisen, of course, in this context, whether medical records documentation requirements have been changed. And interestingly, most states have said no to that as well, which is interesting because query how that matches up with what Medicare and Medicaid are saying about the elements of a record that don't need to be present in order to qualify for payment. And lastly, the states have been very concerned with the question of whether controlled substances can be prescribed via telehealth, basically because of the concern about opioid overprescribing by physicians. Most states that have addressed the question, though, have said, yes, you can prescribe controlled substances via telehealth services, although most have also said that you can do so only if federal law permits. And the question there is going to turn upon whether the Drug Enforcement Administration is going to allow it.
So, James, this one of my observations in doing podcasts around the coronavirus health crisis or this era has been that trends that were sort of percolating long before 2020 in many instances have accelerated almost exponentially. And it would seem that telehealth and issues around telehealth certainly fall into that category. But you, as someone who has to help either a regulator or a physician who may have gotten in trouble and is part of a disciplinary procedure, are helping to provide oversight through a monitorship. Have you all been thinking through that a monitorship or other oversight issue in the era of telehealth?
Oh, absolutely. The question for us, most of our monitoring of physician providers has been through reviews of patient treatment records. So the question presents itself to us as powerfully as it does to regulators across the country. How do you evaluate quality of care in that environment? And it's going to be very interesting to see whether we start looking at alternative ways of measuring quality of care. Whether patient treatment records are going to continue to be an important benchmark to look at in all of that, but we may also be looking at at other questions to see whether quality of care is preserved, even though the treatment records are not what we have typically expected up to now. My expectation at this point is that telemedicine is going to continue, whether an end to the pandemic will mean an end to these sort of temporary exceptions to record-keeping requirements is a good question. It'll be interesting to see what happens with that.
Well, James, I used to ask people a question, ending question, something along the lines of, where do you see all of this in Q3 and Q4? And unfortunately, now I have to ask, where do you see all of this perhaps 12, 18, or even 24 months out? Will you anticipate an acceleration of the trends you are already seeing, or perhaps something else?
Well, there's a variety of things that could happen here. I think the push towards increased use of telemedicine services is going to continue. Part of the reason for that is that telemedicine is an effective way of delivering services at low cost to patients in rural areas, patients who are among underserved populations, who may not have immediate access to a physician's office or a way to get to an appointment. So I think the trend towards increasing use of telemedicine is probably going to expand. That's particularly true, I think, probably in behavioral health as much as physical health. What I don't know at this point is whether, as I said earlier, whether the record-keeping requirements will keep pace with this, and whether regulators will start looking to different ways of measuring quality of care standards. The National Committee on Quality Assurance, for example, has developed a whole set of standards for recognizing physician practices on the basis of their meeting various standards in terms of delivery of services. Will regulators now follow suit in terms of looking at provider performance? Good question, and we don't know the answer to that one yet.
James, unfortunately, we are near the end of our time for this episode, but I was wondering if our listeners wanted any additional information, where could they go?
I invite them to contact affiliated monitors directly. They can contact us through our website at affiliatedmonitors.com or through our toll-free number. And let me see if I have that available. I should. You can reach us though non-toll-free at 617-275-0620.
James, I hope that perhaps as we move out to this 12, 18-month or even 24-month timeframe, I might be able to call upon you to come back on the podcast and give us an update of where telehealth is and particularly your part in monitoring.
I'd be very happy to do that. I'd look forward to it.
Hello, everyone. This is Tom Fox again. I'd like to thank you for listening to this episode of Compliance and Coronavirus. This is the only B2B podcast which brings clear and sane information for both the compliance professional and the business executive. If I could ask you to do one thing, if you could tell one person about this podcast, I'm trying to get the word out about this most unique podcast in the Compliance Podcast Network. So if you could tell one person about it, send them a copy, send them a link, do something to help me publicize this podcast, I would greatly appreciate it. Compliance and Coronavirus is a production of the Compliance Podcast Network, and it appears Tuesday, Wednesday, and Thursday of each week. Thanks again for listening, and I hope you'll join me again for another episode.